Hello there, Dr. Brian McKay, Core Health and Darien. Today, we're going to talk about an exciting topic, for me at least, plantar fasciitis. Very tough word to spell. Fasciitis. All right, what is it? Well, the plantar fascia is a covering on the muscle, and you got a lot of nerves in the fascial plane. Many nerves. And in the feet, you have a ton of nerves regardless because of all the sensory input. You have motor and sensory overload. Actually, you have in the hands as well. So when this happens, you're going to have a serious amount of pain. The tissue becomes inflamed, stretched, and a lot of it I'm going to start out with is biomechanical. There's a biomechanical underlying structural defect. And a lot of times this can be really helped with an orthotic. An orthotic is an insert, a shoe insert. And there's some several, there's one particular brand called Superfeet, and they run about $30. And a lot of times that's going to do the trick after you address the structural defect. What I'm saying is, as a chiropractor, we adjust the feet. So by adjusting the bones in the feet, putting them back, I mean, you may have had a sprain a long time ago, and now all of a sudden it never really healed. So years and years of walking on it, or months and months of walking on it, can actually make it worse. So we have to reposition and make sure the bones in the feet are working properly. That's probably job number one. Well, for me, that's job number one. Job number one for you is going to be putting, getting yourself out of pain, and that's understandable. You want to get out of pain. You can definitely take an Advil and leave, but Advil and leave or really just don't address the structural issue that's causing the tension on the plantar fascia. So if you think another thing too is a cortisone shot, same. You're not addressing the underlying pathology, and that being that the structural mechanics are off, making the fascia work harder and inflaming that thick band of tissue that kind of connects the heel bone to the toes. So, a lot of times, you can, you can take an X-ray. It's not going to show. Well, sometimes it shows a heel spur because the plantar fascia, it's a connective tissue, and it goes into the heel, and it pulls on the heel. As it pulls on the heel, the place where the greatest tension is will tend to calcify. So in some cases, people opt for surgery, which, hey, listen, you got to do what you got to do to get out of pain. Not everybody listening to this podcast can come to Core Health and Darien for treatment on the plantar fascia for fasciitis. So the other thing too is, cortisone is a very powerful immunosuppressive, and it will wipe out the inflammation. It does a phenomenal job of wiping out the inflammation. But the thing with the cortisone is a very, very powerful thing. There's a lot of side effects. It suppresses the immune system. It suppresses everything, and that's how it gets the inflammation out. But like if you're going on a trip, say you're going on your honeymoon, or you're going on a golf trip, and you want the instantaneous relief. Cortisone injection is not a bad thing. Athletes use it all the time because it gets them back on the field, and their careers have a short lifespan as it is. So, with plantar fasciitis, the first thing I would say is, if you're doing it at home, you would take Advil or Relief. You ice it up after you use it. It's going to let you know when it's aggravated. And icing at that point is I think a lot better than heat, because we're dealing with an acute flare up of that tissue. Secondly, get yourself an orthotic. Superfeet are in almost every running store, and they're like $30. So it's not a bad quick fix, and sometimes that's all you really need. It helps stabilize the foot mechanically. And now, if it doesn't stabilize the foot, that's where you got to call Dr. Brian at Core Health in Darien, 203-656-3636. But let me explain how I treat plantar fasciitis. I mobilize the foot. I go over the biomechanical defects in the foot. And when that is addressed, I then use a very special technique called Graston, Graston, Graston. Now, nowadays there's a lot of names for Graston, I got to tell you. And it's another long-winded name is IASTM. Idiot Apple Sam Tommy Mary. IASTM. It stands for Instrument Assisted Soft Tissue Manipulation. Basically, exactly, it's a lot easier to say Graston, so I'm going to use Graston. Graston was a technique developed by a osteopath in the UK. And what he found was, and he didn't invent it, but he got the name. It really started out as a Oriental medicine treatment. That what they would do is they'd actually take a spoon, lubricate the surface area where you're having the pain, and the surrounding areas. It's very important to realize that the surrounding areas are also involved with plantar fasciitis, and they would rub the surface to kind of, in a sense, I want you to picture this because you're listening here. Picture as when you're rubbing the surface with what they did years ago was spoons. They would rub the surface kind of just think of it as erasing the adhesions. And an adhesion is what forms inside the muscle, the covering in the fascia. Now, here's how you how you conceive fascia. Fascia, if you took a pound of hamburger meat, put it into a Ziploc bag, the muscle is the meat, the bag is the fascia. Both have nerve interventions, okay? But kind of differently. Now muscle's going to have sensory and motor. The fascia is primarily sensory. And sensory nerves are very important for the brain to get a handle on what's going on. So you have a lot of nerves in the feet, and when you irritate, it's going to be painful. So what happens is in the surface, so I just mentioned, like the Ziploc bag is the fascia. The surface of the Ziploc becomes pocked or with adhesions. And so what happens is it kind of contracts the tissue. So if you, in your mind, picture it as a Ziploc that all of a sudden morphs into a bubble wrap bag, okay? The surface becomes pocked. And what happens now is you use the soft tissue treatment called Graston nowadays to erase those pocks. All right, does that make sense? And in doing so, and it does hurt. It's painful when it's getting done, but you can sometimes feel an immediate relief once it's over. So that's the good part. But what happens now is after the fascia, after the adhesions are addressed, so now we have to take it to another level. What is that level? It's going to be laser. And the laser emits these photons, which are packets of energy, into the tissue and jumpstarts the healing process. That's painless. That's the good part. But the results are really, really outstanding. I got into it a long time ago, and you kind of learn as a doctor. Now I'm a chiropractor, so you may not consider me to be a real doctor. I really don't care what you call me as long as I get you better. And I don't think you mind either. But I get the bill as a doctor at least. So in this case here, what I've also learned is there are many of the muscles involved with a chronic case of plantar fasciitis. Primarily, we're definitely going to look do we have to do Graston, or we have to do some soft tissue stretches into the calf muscles. But there's also a muscle that goes that, like if you put your hand on your knee and then go towards the outside part and slide your hand down to your ankle, and just dig in there, because you might find some rough spots, and those rough spots are adhesions in the surface, in the fascia of what we call the tibialis anterior muscle. The tibialis anterior inserts onto the foot. And again, I find that the tibialis anterior actually almost invariably, most of the times, on the plantar fasciitis cases I see. So by addressing those areas. Now, another thing too is you could have the not so much the hamstrings. I really find the quadriceps; those are the muscles on the front part of your thigh, and it even goes up to the pelvis over a long period of time. So it's really important that those things get checked out mechanically and palpatory, because you're going to find these areas. And if you address all these areas, the problem's not going to come back. Now, that's why I think the treatment that we offer here is superior to a steroid injection. But again, I'm not opposed to steroid injection. I'm definitely opposed to surgery, because you got to try this before you go to move to surgery. Surgeries on the feet are they're pretty significant, because once you have the surgery, there's no going back to it. So it's really a quite the issue. So so I guess that's my basic program. Is we find the muscles, find the biomechanical defect, address the adhesions, zap it with laser, and basically get you better. So it's kind of I know most people want to take the easy route, and in the beginning, I get it, man. You're hurting. I was doing a lot of yard work yesterday. My wife says, you better take some Advil before you go to bed. And I did, because you want to get through. You want to get through that pain. But at some point in time, long-standing pain you're going to need to address. And if you've got plantar fasciitis, I would be more than happy to talk to you about it. You can call me. I don't care if you're in Alaska or Hawaii. 203-656-3636. 203-656-3636. I'll tell you what to ask, what to look for in a doctor, and even help you find one. All right. Thanks for listening. Have a great day.